typical flu symptoms gets better, and then 3-4 days down the road he comes back with high fever, cough, etc. Because these are the cases where you start worrying about a complication, a bacterial pneumonia or something like that. And so in adults, similar things, these are the signs that should urge you to consult with your physician. If you have seizures, if you have confusion in your mother who's a 90-year-old at home, difficulty breathing, etc. Prevention of influenza, how can we prevent it? This is the most important. The way to prevent the spread of influenza is very simple. It's what your mom taught you as you were growing up, basically. It doesn't need a medical doctor to tell us how to prevent it. Basic hygiene measures, cough etiquette. If you're coughing or you're sneezing, you know you have a cold, never leave house without having, something to cough into. The cough etiquette is when you cough into your napkin. Sneeze in your sleep is another widely recommended thing. If you suddenly start to having cough and you don't have a napkin and you start sneezing, you might be seeing people in 2 minutes and you might be shaking hands. So to prevent you from being embarrassed, not to say I don't want to shake your hands or etc., and you're sneezing, you sneeze in your sleep. So because you're not going to be shaking hands, touching the sleeve. So sneeze in your sleeve is another widely recommended way. I cannot stress enough hand hygiene. Hand hygiene is the way to clean our hands, because as I mentioned, the virus can be spread by airborne droplets, but it can be spread by touching contaminated surfaces. The most contaminated surfaces are going to be your hands, because you have sneezed, touch your nose, etc. And so therefore, to do hand hygiene, you have two ways, either soap and water, the classical way, or the what you see on the right, the alcohol-based solution. I think you have seen them all over. These are solutions that have more than 60% alcohol. If you rub them into your hands, but then you have to rub it for 10 to 15 seconds, you can get rid of any germs from your hand. So the key is to use them not only once, but use them and use them properly and drop all the surfaces. So basically this is what you do. You put the solution and then you do this, but you have to cover all the surfaces because the virus can stick in the inner parts of the fingers. Face mask. And again, if you have a flu-like illness, whether it's influenza or another virus, the best way to prevent it from spreading to others is to wear this paper surgical mask. And as I mentioned, all body secretions should be considered contagious. To prevent the spread of influenza, the stay-home policy, initially the Center for Disease Control of Prevention in the US recommended to stay home for 1 week. They have realized that this is not practical, and basically what they've done is now tailoring their recommendations to say stay home until you have had no fever for 24 hours, which at the end might be 7 days, because typically influenza symptoms last for 5 to 7 days. So if you have 5 days of symptoms and then you have to wait another 24 hours without fever, that might be around 5 to 7 days. But this is the more recent recommendation. If it is necessary to leave the house, let's say you need to take your child to go see his doctor, then make sure you put a mask on his, to cover his mouth, but also his nose until he's back home. And avoid visitors. We live in Lebanon, where social is just too stretched. I think we overdo it in Lebanon. We call to say, grandma has influenza, everybody wants to come and see her and kiss her. Phone visits is very good, it's acceptable. We need to tell them, I really love you, I so much care about you, but I'm afraid to bring the virus home and to infect the rest of my family, so I'm just going to call you every day to make sure you're fine. There are two ways we talked about prevention in terms of simple things. What about drugs or vaccines to prevent? Obviously, Tamiflu at the beginning of the epidemic, what we tried to do is, if you had a case of influenza at home, we told them, okay, you take Tamiflu Tamiflu, but let everybody at home take Tamiflu, because we were trying to confine the pandemic from spreading all over Lebanon. But after 2 to 3 weeks, we realized that it's already spread, and therefore, to give someone a prophylaxis with Tamiflu because they have been exposed is really not going to be very helpful, will promote more resistance in the virus, and that's why there are only very limited people who need to take post-exposure Tamiflu. And so therefore, it's not recommended for healthy children or adults exposed in community, school, camp, or other similar settings. The vaccine, you know that there are now 2 vaccines. The one that is available in Lebanon is the seasonal influenza vaccine, and there have always been recommendations for who to vaccinate against seasonal influenza. Basically, they're the high-risk patients or people who work in the medical field, like doctors, nurses, etc., take it on a yearly basis. But the question is, does the seasonal flu, the Vaxigriv or Influvac that is present in the market, does it protect against H1N1? And CDC is telling us that no, it does not protect. And therefore, they're saying that there will be 2 vaccines available, the seasonal flu and the H1N1 vaccine. Another common question is, how can I clean surfaces? What kills the virus? Basically, what kills the virus is heat, 75 to 100 degrees. If you boil something, of course you're going to get rid of the virus. But also simple chemical germicides, chlorine, Clorox, of course is going to kill the virus. Hydrogen peroxide, the detergent that you use to wash dishes, etc., the simple ones are going to kill the virus. Betadine, etc., is a very potent virucidal, and alcohol, anything above 60% alcohol, if used in proper concentration. Okay, I come back to the last part, which is the frequently asked questions. I think many of those questions you were going to ask me, but at the end of which, if you still have other questions, again, I'll be very happy to answer. How does novel H1N1 compare to seasonal flu? As I said, there isn't much difference in terms of it can be mild, it can be severe. The one difference is that there seems to be a high rate of infection and maybe more complication, again in Mexico, in the 25-year-old group, which we did not used to see with the seasonal influenza. But other than that, the highest patients for complications are the same for both. Why worry and why not worry? In my opinion, we need to worry, obviously, because the virus is spreading, we have a lot of illness, we have absenteeism from school and from work, so it is a big headache for all of us. But I think we have reasons not to worry, and that, as I explained, the virus seems to be mild and self-limited in most cases. We have treatment available for the high-risk groups. We can diagnose it in the high-risk group. The expertise in dealing with the cases is building up internationally, but also in Lebanon. I think doctors, they panicked at the beginning. I'm talking about the non-specialists, but now they have become more familiar with dealing with these cases. We had nurses at the beginning of the epidemic saying, I don't want to touch a patient who has H1N1. They were so concerned about getting the disease. Now we get a patient, some nurses even don't wear their mask. They're like, I get it, let me get it, بخلص منه before the cold comes. So people have become much more comfortable dealing with the virus. And there is obviously increased awareness, and people are more careful about washing their hands, using cough etiquette.